So Nicole, what is a plaque score and why do you guys take every patient's plaque score?
So plaque score is a number that detects how much plaque is on the patient's teeth. It's used with a disclosing agent, so it's usually a pink or a blue solution that gets placed on the teeth and the patient rinses so that we can see it visually on the teeth. A lot of the times when patients do get this this staining on their teeth, they do see that they're missing a lot of areas with their toothbrushing and their flossing. So that's the reason why we do the plaque scores, is to show the patients, because a lot of the times when we do see areas of breakdown and some areas of inflammation, it's the areas where they're missing with their floss, their brush, their proxy brush, anything that they're using at home. So that's why it's very important to be using these plaque scores to help the patients at home with their home care. A lot of the times when I do get patients and they do see the staining, they say, I do everything at home, why do I have all this staining? And it's because maybe they're not angling the toothbrush correctly, or maybe they're missing their back molars with the toothbrush, or missing in between with the floss. They just need to be taught, because everybody feels like they can brush and floss correctly, but maybe they're not. Have you had any experiences with the plaque score that has changed people's lives?
Usually with the plaque score, I find that patients are flossing incorrectly. So once we put the disclosing solution on the teeth, Nicole and I open a clean piece of floss and we show them how to correctly wrap the floss around the tooth and go underneath their gums. Most patients are scared to floss underneath their gums because they think that they're bleeding when they're flossing underneath their gums, or they're going to do damage to their gums if they go underneath. But there's an area between the tooth and the gums that's called your free gingiva, which means that it is movable and you can go underneath your gums safely. If you're bleeding while flossing, that means that you have inflammation, and it's not healthy. Any bleeding in your mouth is not healthy. So when we wrap the floss around the tooth, Nicole and I are able to show the patient how to remove the plaque. So with the pink solution on their teeth, we actually show them to rub off the pink solution with floss. And then the patient always says, oh, I wasn't doing that. And then the next time they come in, we take the plaque score again and we see an improvement. And then they know that they're doing a good job. And then with the brushing, we're able to show them how to properly angle the toothbrush, which most patients don't know. A lot of patients move their toothbrush up and down or in circular motions, but the correct way is to move it side to side. Children are supposed to move the toothbrush in a circular motion, and a lot of patients don't know that.
What would you say is a healthy plaque score?
So a healthy plaque score is anything under 15%. So the lower the better. Your whole mouth would be 100%. So you would never want your plaque score to be 100% because that means that your whole mouth is covered in plaque. So if a patient comes in and their plaque score is 60%, their goal for their next appointment would be half of their plaque score, so it would be 30%. And then each time we see them, we like the number to go down, and that means that they're doing a good job at home, and Nicole and I are doing a good job teaching them.